Good afternoon from the American IV Association. Thank you for joining us today for a complimentary webinar. We are just waiting about another 30 seconds or so for everyone to join on. And we have a couple of exciting presenters here today, Nicoletta Rizizzi and Jessica Dotto. They have an awesome presentation for you covering IV nutrient therapy for healthcare providers from a high level and some really interesting detailed information for everyone. It looks like we've got about half of our attendees have jumped on, so we're going to go ahead and get started. We do have a question functionality through the GoToWebinar portal. You are welcome to submit your questions, though we may not be able to answer them during the webinar. We would be happy to follow up via email afterwards. So go ahead and submit those. Everyone is in listen-only mode, so I'm going to turn the controls over and we will get started. Thanks for joining us.
Hi, everyone. My name is Nicoletta Rizizzi. I'm a registered nurse at Replenish Health and Wellness. I've been doing IV nutrient therapy for the past 15 years. Along with me, I also have Jessica Dotto. She's a nurse practitioner that also offers IV infusions in her practice. And we'll be both discussing different aspects on how to utilize and bring more revenue to your facility depending upon what you would like to offer. So I'm going to go through some slides. Again, if there's any questions that you would like to for us to answer, we will answer as much as we can at the end, or you can put your questions in instead.
Hi, everybody. I'm Jess. Nicoletta is going to get us started and go through all the slides. I'm going to chime in now and again again at the end. So as Nicoletta said, I'm a nurse practitioner. Nicoletta and I are both in the state of New York, and we both kind of find synergy with each other in including IV nutritional therapy as it applies to skin health in particular and medical aesthetics. Which is pretty exciting for us and hope it is for you too. So Nicoletta is going to walk you through some really interesting applications and some trademarked, she's not going to give away trade secrets, but she's going to talk to you about how she includes this in their practice. They're very pioneering in her practice on having custom infusions for skin applications in particular. And then we're going to talk to you also about some marketing and revenue solutions as well. Okay, Nicoletta.
Thank you. So the beginning slides is a little bit about myself. I'm gonna just move a little bit forward on today's agenda, what we'll be discussing. It's like why IV nutrients in the aesthetic medicine setting, the efficacy of it, how to utilize microneedling, and building a strong foundation for the skin matrix. It's really a different approach on how to bring more revenue into either your medical spa or dermatology or plastic surgeon's office, even an aesthetic practice as well, when it comes to using different aesthetic procedures, utilizing IV nutrient therapy. I'm going to touch base on very basic vitamins, minerals, and amino acids, and how that can help the different layers of the skin, and what exactly is behind all this aside from what it is being used in other facilities today. So why is it beneficial to add IV nutrient therapy in the aesthetics practice? You want to stand out from your competitors. I can say, you know, IV infusion therapy has been going on for over 40 years. It has changed a lot in the last 10 years, and I would say in the last 5 to 7 years, more and more practices such as medical spas and drip bars have been opening up, being interested into, in this field. And I feel like everyone's like up to the point of what's the next step? What else can we offer to our patients or clients? And I will go over a lot of different topics regarding this when it comes to anti-aging medicine, when it comes to aesthetic medicine, using what you have in your office right now. So if you do have, different types of lasers, if you do microneedling, if you do chemical peels, there's a lot of things, different procedures that everybody has, and it's so saturated, but you want to kind of bring something different to your practice. Everyone wants the new and up and coming thing of what to do next. So everything that, I put together, it kind of is the basis of what IV nutrient therapy, what it does to the body, right? Everyone knows that it boosts the immune system, it gives you energy. Whenever, some facilities use it for hangovers. In our office, we do use it for functional medicine, but I wanted to put a little bit of a twist on it, which I've been working on for the past 6 years when it comes to using it for aesthetic medicine. In the beginning, when we opened up our practice, we noticed that a lot of our patients who were doing IV therapy long-term, when I say that, I would say like once a week for 10 weeks, that their skin has changed or they look great and less fine lines, brighter, less hyperpigmentation. And I was very interested in this from a different perspective and looked into it a little bit further. As each year passed by, and I've been doing different types of aesthetic procedures, I incorporated a lot of different vitamin infusions along with my procedures, such as if I do have a patient that has hyperpigmentation, fine lines, wants to even out the skin tone, and they wanted something very minimal, such as chemical peels. I started to use IV nutrient therapy along with the chemical peels. The results were astonishing. The skin needs the nutrients in order for it to be have that glowing effect, diminishing fine lines. And this is, the things that we are evolving in. And I personally feel that this is a new way to aesthetic medicine and anti-aging once it gets out into the field more. So when it comes to critical thinking, right, using IV therapies, I am assuming many of you either already have or offering IV infusion therapy within your practice, or are interested in starting something, or is it you have an aesthetic practice or spa that want to incorporate this and kind of give it a little bit of a twist. The slides that I have up right now, the most important thing is to gain access to the cells without GI interference. Some people may have gastrointestinal issues, which leads to poor malabsorption. So they can't take high doses orally when it comes to vitamins and minerals. So some causes of this may be, let's say if a patient is diagnosed with Crohn's disease, structural issues, or even other ailments such as overactive thyroids. These are all indications that you have to consider before giving an IV infusion, how it can affect the skin and the dosage that you're using to actually have an effective result. Infusing materials with larger quantities than what is taken PO. Again, same thing, benefits IV therapy go directly into the bloodstream. You can use higher therapeutic dosages without having any GI upset. Monitoring patients and adjusting their treatments. What we do in our office is we do vitamin panels and levels, drawing blood, and see what the patients are deficient in. Are they deficient in, vitamin A? Are they deficient in minerals, vitamin C? These are important factors for yourself to understand what each patient is deficient in, so you can utilize and make a customized infusion for these types of patients. Improve overall health and skin rejuvenation through essential nutrients. By doing that, it comes to using IV therapy treating the skin. What many do not realize is that the aging skin is a direct result of being deficient in vitamins and minerals. If you correct the deficiency, you can heal and repair the skin using both IV vitamin therapy and non-invasive aesthetic procedures. Jessica, if you ever want to jump in, you let me know, okay? I did a little diagram on how is the skin treated using different types of aesthetic procedures when it comes to superficial, deep peels, medical microneedling. We have the Neo laser in our office, and what we at our office pioneered in is what's called the skin IV. And it kind of gives you a picture of how we are fully treating the integumentary system down to the blood vessels, okay? You can use superficial peels such as alpha and beta hydroxy to treat the outer layers of the skin. You could use a higher percentage of TCAs in order to penetrate the skin a little bit more deeper. I truly believe in doing medical microneedling, which is about 1.5 to 2 millimeters into the skin. And what I've seen is that the patient is using their own growth factors to repair it. The Neo laser that we use in conjunction with our skin IVs and microneedling goes down to the dermis. It hyperstimulates the growth of collagen. The combination of the skin IVs, infusion, going directly into the vein, it breaks into the capillaries. As you can see in the diagram, right? You have an IV infusion going through the veins. From the veins, you see the capillaries going into the dermis. This is what feeds the skin the proper nutrients it needs in order for it to nourish the skin. Kind of give it that boost to produce more collagen. You're treating the skin, the elasticity of the skin. I hear background noise, I'm sorry.
I think we can hear you just fine, Nicoletta.
Okay.
Yeah. Are you getting feedback on your end?
Yeah, I am.
Okay.
Back to, using the capillaries, using the IV nutrient therapy, it starts a chain reaction, right? It starts a chain reaction to heal the skin from the inside out. You're not only treating the skin externally by using either lasers or chemical peels, microneedling, but now you're treating the skin internally using IV hydration therapy.
And yeah, Nicoletta, and just to tag off of that a little bit, depending on the types of lasers and technology you're using, the depth of penetration through the skin, like if you're using ablative laser, for example, you want to heal that stratum corneum faster. So, so if you have that type of technology in your office, say you're doing CO2 laser and you're doing resurfacing, which is pretty heavy duty, so you're creating a pretty large wound. If you are in a position where you want to prep the skin first, which I always recommend, then you want to bring that client in first for, like, say, 2 IV therapy sessions beforehand to prep, and then a couple of sessions afterwards, because it's going to speed wound healing. So, in that example, if you're doing, a deeper peel or some sort of deeper resurfacing, you're going to decrease your healing time through providing IV nutrients. So think of that as kind of like your, even in a surgical, but yeah, it's less downtime. So, and then other lasers, like using the Neo Elite, which is an Nd:YAG 1064 laser, that's going to go deep dermis. It's going to go into the capillary beds because, the Neo works to the depth of hemoglobin. So if you're treating redness and things like that, again, you're kind of sandwiching the skin inside and outside by using those multiple modalities. So any other technology that you have is just going to be supported by using your IV therapy.
Correct. See, we're always on the same page, Jess. So next slide, it has to deal with microneedling. Again, that's a very big part of my, in the practice when it comes to utilizing this along with other aesthetic procedures. Later on, I will show you before and after photos. And how this helps utilizing both the IV hydration therapy along with topical treatments. There are 3 different types of microneedling. There's, the cosmetic microneedling, which is only 0.5 millimeters to 5 millimeters. This is when, you could do it for a younger populations, ages between, 20 and over. Do more frequently, once a week for 6 weeks, just to keep up their collagen growth and use it as a preventative measure. Medical microneedling, it's from 1.5 to 2.0 in depth, and that is more for people who are 35 and older. I like to use the medical microneedling a lot of the times because that's my population of patients. I utilize the skin IVs at the same time as doing microneedling. It also, from a revenue standpoint, I'm sure a lot of you have patients either prepping for an aesthetic procedure that may cause some discomfort. So you want to utilize that time. You want to, you want your money to be well spent or made really when it comes to time. So if a patient is sitting and having either EMLA or numbing cream on their face for about a half hour to 45 minutes prior to a procedure, utilizing an IV infusion, you are making money while they're sitting in that chair. And that's something that, we do a lot when numbing is involved. Surgical microneedling, 2.5 to 3.0, it's kind of the same thing, even if we do like what Jessica has stated earlier, like a Fraxel CO2 laser that's more in depth. There's different ways of perforating the skin in order to stimulate bleeding for more collagen growth. Okay, so when it comes to medical and surgical microneedling, I'm just gonna discuss a little bit of science behind it. You have to think of the skin kind of like the function of the skin like a factory, right? It's designed to receive raw materials from food to be healthy. But in today's society, everyone's stressed, poor diet, lack of sleep, exposure to free radicals. These all work as a whole in the aging process and the aging skin. And in the medical and surgical microneedling treatment, you need that bleeding aspect of your own stem cells to start to repair. This is what you want. This is a positive response to that. The release of the red blood cells, white blood cells, platelets. They start the process of building the fibers of the collagen and elastin. This is where I feel, and from my personal experience, IV infusion therapy is crucial. When using 2 treatments together, it's giving the factory, right, the skin, the nutrients it needs in order for it to heal, in order for the skin elasticity to actually grow the proper amount of collagen, to give the skin the nutrients it needs in order for it to heal for less downtime. There's so many positive things behind this when it comes to utilizing IV nutrient therapy along with aesthetic procedures. So these are the things that are missing. I touch base on minimal things when it comes to vitamins, minerals, and amino acids. I know most of you do offer IV nutrient therapy within your office already, and but there's a lot of things that we should be looking more into when it comes to vitamin C, how it actually is a whitening vitamin for the skin. So patients who have melasma, patients who have hyperpigmentation, sun damage, high dose vitamin C is amazing for, let's say, a course of treatment of once a week for 6 weeks, using this vitamin as an antioxidant, which is repairs oxidative stress. It produces collagen. It moisturizes the skin, believe it or not. when vitamin C is used topically, it can dry out the skin. And some patients, they kind of not like that. So I kind of thought outside the box. I was like, okay, so if we use vitamin C internally, will it have the same effects? And it doesn't. It actually does the opposite than what a topical does. It actually makes the skin supple. Patients see a different skin tone, especially when it's utilized with chemical peels. These are a few vitamins and minerals that I use when it comes to IV infusion therapy. B vitamins, it also attracts moisture. Its ability to fill the gaps between the dead skin cells. It also helps soften the skin. It prevents dryness. So these are things for an older population, like 45 and older. This is what patients are looking for. And you can put a spin onto that when it comes to your aesthetic practice. Biotin, everyone knows about that. But when used in IV form, it's amazing when it comes to the healing process, especially when you're using ablative lasers and medical microneedling, or even deep chemical peels that are being used. Minerals, certain minerals such as magnesium, it actually detoxes the skin. It reduces inflammation. You know, this is so important when it comes to healing the skin when using ablative and more invasive procedures on patients. It truly does bring the downtime. Let's say if it'll usually be a week, it'll be in 5 days. Taurine, which is an amino acid. Not only is taurine amazing for your brain, for your brain cells, for cognitive thinking, it also boosts circulation intracellularly and gives energy, right? So it helps rehydrate the body. The skin looks amazing, along, you know, with other amino acids and other vitamins and minerals with this. It brings a whole new gamut of looking at the skin using IV hydration therapy in a new way.
I'd just like to chime in about other types of things as well, like when it comes to minerals and other vitamins as well. Like, don't forget about your vitamin D. Even though we're not infusing vitamin D, look at D3 levels in your patients. D3 significantly inhibits proliferation of keratinocytes in conditions like psoriasis as well. So, you know, if you see, you know, patients coming with, you know, conditions like atopic dermatitis and psoriasis, check your D levels, because while they're, you know, in that numbing chair, see if they want a shot of vitamin D.
A lot of rosacea too.
And rosacea, exactly, and a lot of autoimmune conditions as well. You know, and just generally, vitamin D supports immunity and has like antimicrobial activity as well. And then some of your other trace minerals like zinc and copper, selenium, like zinc and vitamin C work together as antimicrobials. So you think about that like in your acne patients. So if you're doing microneedling on for acne scarring and somebody still is having breakouts in between, you know, zinc and copper, zinc and vitamin C together work really well. Copper as well together with peptides are good for oxidative damage and also for UV damage as well. So for your sun damaged patients, you might want to think about, you know, those types of minerals as well. And then, you know, glutathione, everybody loves glutathione.
Yes.
It's a big buzzword. Everybody knows about glutathione. Yeah, and that's just good for everybody. You know, for all skin
liver
conditions.
Detox. Yeah.
And for, yeah, and when your liver is healthy, your skin is healthy too. So you know, so just, you know, start to think about kind of the things that you, yeah, and the things that you offer in your office and the type of patients that you have, and think about you know, what things do you have readily available that can help support the patients that you have.
See, you brought up an excellent point, Jess, because when it comes to the patients that we see, and I'm sure you do this because you offer, this into your practice as well, is getting a little bit more of a history from your aesthetic patients. You'd be surprised at how many of your patients do have an autoimmune disease or have a thyroid condition.
Yeah,
or,
that's big.
And premenopausal, postmenopausal. These are crucial factors that we can bring their, not only their health, but their anti-aging from internally, also externally, by using the proper nutrients that their body needs from the lack of what they may have based on their blood results. So, this is something maybe to consider as well when you are interviewing your patients and having a consultation with them for the first time. A lot of the times we ask, are you under a lot of stress? How is, your eating habits? Do you have any autoimmune diseases, any skin conditions that run in your family? If you take all of this into consideration, you could actually form a plan already as to what should be given to this patient and what would be the proper procedure that you offer along with it.
Absolutely.
So how laser procedures work with microneedling and IV hydration therapy. It works amazing. There's no other way of saying it. I've been doing this now when it comes to IV infusion therapy with skin IVs for quite a few years now. And before I even used IV hydration therapy, I see the results of when I used them and when I did not. It is crucial. I personally feel this is crucial to add this to an aesthetic practice due to the fact of what each age group need. When it comes to preventative, when it comes to any skin conditions that go along with autoimmune diseases, like Jessica said, when it comes to psoriasis, when it comes to rosacea, melasma, post-pregnancy melasma, there's so many things involved that a lot of things that are out there already when it comes to aesthetic procedures really might not cover. So what you're actually doing is bringing your facility to the next level of treating everything. And that's something that I guess my point to bring to everyone today is that you can utilize IV hydration and nutrient therapy on so many different levels when it comes to the medical aspect of skin conditions, all the way to the aesthetic aspect of skin conditions. Let me see. Okay, what are the most common nutrient IV subsidiaries and their indications while using laser procedures? So because we use the Neo Elite, I love this machine. I use it, I think, outside the box, especially when it comes to co-treatments of microneedling and IV infusion therapy. The way this technology works when it comes to the stimulation of collagen on a deeper level, along with what IV infusions formulas are put together to enhance that treatment more, is incredible. And I'm going to show you before and after photos, and you can see what I mean when it comes to using both hydration therapy and aesthetic procedures, especially when it comes to acne patients as well. Jessica said earlier, for inflammatory, how the body acts from an inflammatory response. You're using IV nutrition therapy to bring that inflammation down. You're using minerals such as zinc, which can reduce acne by 50% when it's done by IV. I mean, there's a lot of different things that can be put together in order for the IV infusion therapies to work really well with other cofactors. So here's a patient of mine. You can see on the left side, she has skin laxity. She had some bone loss on her left side of her face, and which caused a concave look, and she looked very withdrawn. And she didn't want to do a facelift. She wanted to go more the natural route. She was not opposed to doing injections, but actually, believe it or not, the picture on the left, she already had, by another practitioner, 3 fillers on the left side of her face, and nothing has changed. So when she came to me, I was like, okay, I can inject you all I want, but it's not fixing the problem when it comes to rebuilding your skin up again. And this is where it comes in, using the laser that I use, using the microneedling from your own stem cells growing and getting that skin matrix to build up again. The skin IVs treatments was such an asset to her. As you can see on the right side, I mean, her face became fuller, fine lines, her nasolabial folds. I did not do any fillers. I did not do any Botox. My philosophy when it comes to my patients is treat the skin first. Then we'll have fun doing the fillers and the Botox. Without treating the skin first, you're not going to get the full results that you would want. And as of now, this has only been, 6 treatments of, laser, 3 treatments of microneedling, and 4 skin IVs. And this is all done in a matter of 3 months. So this is a result post 3 months of starting treatment with her using the microneedling, skin IVs, and the laser. Now we're going to have fun doing Botox and fillers. So this is one of my patients that I was so happy, and she was happy herself when it comes to, these combo treatments can result in. This patient, she had hyperpigmentation, she had hollowness in the eyes, she was afraid to get fillers done. So she wanted a different approach as to how to treat her skin. So what we did was we did, 3 treatments of laser, and we did 3 skin IV infusions. No fillers, no Botox, no chemical peel. And this is what we did. And this is what it resulted in. And this is after 3 treatments, and I believe these treatments were 3 weeks apart. So as you can see, what IV infusion therapy can do to the skin when it comes to hyperpigmentation, skin laxity, the tiredness. She even looks more healthier. This is what the body needs, along with aesthetic procedures of making, number one, the patient feel better, patient look better, and let them be the best they can be when it comes to their appearance and how they feel. This patient came to me. She is a smoker and has been smoking for years. And she didn't want to get a facelift. She wanted to use a different approach as well. And I was like, okay, we can do this. We can, do different protocols and see how this can, turn out. I couldn't promise her anything. But as you can see, the difference of only doing 6 treatments of laser and 5 skin IVs and 3 microneedlings, I truly believe the skin IVs, along with these other procedures, was a crucial part of her healing process and bringing back the elasticity of her skin. Her next steps now would be Botox, would be fillers, but you can see how her skin has changed periorally, nasolabial folds, even her profile picture. It's phenomenal how when you give the body the nutrients that it needs in order to heal from the inside, and you're using topical treatments from the outside, the results can be, pretty profound. This patient, she had breast cancer. She had breast cancer 5 years ago. She went through chemotherapy, radiation therapy. Her face was as clear as the right side of the photo after she was done with her chemotherapy treatments. 3 years after her chemotherapy treatments, she started to get cystic acne and hyperpigmentation. all over her face. This is what's called chemo-induced acne. Many people have not heard of this term, but there are a lot of chemo patients that do have this reaction. It's your body's own defense mechanism of detoxing everything that was put into your body when you were going through treatment. What I did with her was what we call in our office is the skin acne IV. And I put this formula together, a lot of trial and tribulation. Once I put, all the right ingredients and amounts together, I started using this on her. I started using the chemical peels, and I started to do the laser procedures, and doing all three things cleared her face. She did not go through not one round of Accutane. She did not go through any round of antibiotics. This was all natural. This is when I was like, we're really onto something. This is definitely something that we can help many patients with, using IV nutrient therapy along with other procedures in the office. Jessica, have you found anything in your facility when you treat patients at all?
So I think the biggest thing, especially with the acne patients, we have a lot of patients that come into our office that are have been on Accutane, like you said, and are struggling with going back on it and don't want to, and are really desperate for something that they don't want to go on a systemic treatment. So we work really hard with that patient population to keep them off a systemic medication. And by doing a combination, like our acne protocol is pretty robust as well. It's a combination of decongesting acne facials, peels, the laser treatments, and which is, again, an NDAG 1064 is gold standard for all skin types and tones. So, you can go all the way up to if it's Patrick 6 with that type of device, which is really important. Like that patient you just had, deeper, darker skin tone. So you'd be concerned about hyper and hypopigmentation.
Correct.
In a client like that. So you'd have to be very careful with the technologies that you're using. But along with that, like you said, healing that skin from the inside out is really important. So what we find, especially with the Accutane patients and with our chemo patients, our cancer patients, whether they're actively treating cancer or they're in the remission phase, is they are really, really depleted of vitamins, minerals, and macro and micronutrients. So we try to work really hard with them just on an overall program of enhancing health. So we do that as well. And then, work on the skin portion of it at the same time. So for that type of acne, like you said, it's not, I think, really well known. I mean, Nicoletta, you worked in oncology infusion for a long time, so you probably saw it more than a lot of other people have. But it's really devastating. Acne and acne scarring is really, really devastating.
Especially after what they went through already.
Exactly. You survive cancer, and now your face is a mess. It's a terrible thing to have to deal with. So if you can put them in a program where you can say, hey, we are going to do these types of services in this, 3 to 6 month period, and then get your face back to where it was, that's an amazing thing to be able to offer. And we find that our patients are really happy with the results, and they're really desperate to find a better answer than just take a pill all the time. That isn't always the solution for everybody.
Exactly.
Now that's not to say that I don't, sometimes put somebody on a short course of doxycycline or something like that to get them started.
Of course, they need sometimes they need that boost. Absolutely.
And so everybody's approach is different, but some people even don't even want to do that. We'll have some patients that come to us and say, what, I've been on antibiotics on and off, since I was in high school. Like, I don't want to do that at all. Give me something else. So it's a nice offering to have and say, yeah, we can get you to the place you want to be without taking oral medications.
Absolutely. I guess, the next slide when it comes to the different minerals, amino acids, and glutathiones. Amino acids, they help tighten and firm the skin, believe it or not. Specific ones, when put together, works very well for patients who truly have a lot of skin laxity. Minerals, they act as a cell communicators, so they actually tell the skin what to do. When it comes to zinc for acne, magnesium for anti-inflammatory, vitamin C for, not vitamin C, but, it tells the body what it needs to do when it has the proper levels that it needs in order for it to heal. Glutathione, it actually can improve psoriasis. It could be very important. It reduces oxidative stress caused by free radicals. There is such a different perspective of how to look at IV infusion therapy and the skin that I'm so excited about to have this out to, in the open and educate more people on.
Yeah, and just vitamin C alone, I mean, I feel like it's the magic of all of the everybody talks about the B's and vitamin C, but lack of vitamin C causes delayed wound healing. So if your vitamin C levels are lacking, acne and psoriasis and breaks in the skin in general, those are wounds. And if you're not optimizing vitamin C, you are going to have delayed wound healing. So even like our post-op patients, if we have, I think we had some surgeons in the group here who were registered for the course, not sure who's on right now, who were on for the webinar today, but delayed wound healing, that's a problem. So if you have a patient who is also diabetic, this is an issue. So that skin will not heal properly without enough vitamin C.
Exactly.
So these are things that you need to think about now, because I think we have providers from like a lot of different backgrounds. But these are things you should keep in mind when you're treating your patients. Like what is their final outcome going to be? What interventions are they having, and how can I support them best?
Exactly. So let's see, thought process, what the patient needs. We kind of went over that a little bit in the sense of, if they have an autoimmune disease, what are they looking for from an external perspective of fine lines, skin laxity, fat loss. You want to assess your patient, right? You want to assess your patient and find the proper, IV therapy that would best suit them. What we put together when it comes to skin IVs and also dermo IV nutrition. This is something that our office is really a pioneer of. And I am so excited to actually announce that we can provide this to other clinicians along with education. These are the different types of skin IVs that we put together and are made in individual vials that can be delivered to your practice. And we can educate you on, based on the equipment you already have in your office or the types of populations that you may have, how to utilize all these different types of infusions that we offer to you. And this can really bring your practice to the next level. These are the few that we have available. What each one does, it's very different. We went through vigorous testing for about 6.5 years, and we put the proper dosages and minerals, vitamins, and nutrients that actually you can see pictures before and after photos of a person who used the skin IV and a person who didn't. It's pretty interesting how all of this works together, and I know many of you might have questions on this, and I'll be more than happy to answer anybody's questions, and we'll hold off at the end. I know the time is almost up. I guess this part, when it comes to the logistics, let me just move forward a little bit because I see the time, Jess. I guess you could start talking about the business perspective of things.
Sure.
Okay.
So all of this together, I mean, basically, what we see is a lot of practices, and what I see when I talk about this and lecture on this is, you know, basically like how does this, how can you package this up and market it, and what is the impact on your business? So I think that's kind of it's like, yeah, everybody's doing IVs, but like how does that impact me? Nicoletta, you want to, yeah, there we go.
Yep.
So let's just look at the numbers really quickly. And these are recent numbers from this year. So the global IV infusion market, so this is not just in the United States, and I know we had some people who were registered from other countries for this today. So it's a $54 billion market estimated by 2028. The US out of that garners about 38% of this market. So it's a very large portion of it when you look at the world as a big place, and 38% of that market is huge. The private IV micronutrient therapy market, they're estimating by 2026 will reach almost $11 billion. Medical aesthetics industry, even though we've had a very volatile market and, you know, threats of recession and all that, it's still estimated to reach $30.9 billion by 2030, and it's still a 10.6% growth rate during this period. So you can see that in your existing practices, we used to call aesthetics and everything recession proof, and even though we've seen slowdowns, it really still continues to grow. It might not grow as fast as it has in years past, but it still continues to grow. But as it continues to grow, the landscape becomes more competitive because more people have entered this market space. Nicoletta, thanks.
Mm-hmm.
So how do you differentiate yourself in this competitive atmosphere? So look at what you're doing. So if you are currently providing IV infusion services now, maybe you have an IV clinic, but you're not specializing in one type over another. Maybe you say, okay, you know, we have these 15 IVs, and you kind of let your clients select what they want rather than you meeting them and selecting for them and based on a consultation. So are you selling packages? Look at what's your number one IV infusion and look at your patient demographics. So how can you hone down on what they're getting? So if you see, like, if you offer like a glow fusion, you know, if you offer your version of a skincare IV package, and you see that, you know, your patient population is, you know, younger people in their 20s, and a lot of them are getting glow fusions because they have a problem with acne, then you want to capitalize on that and look at the skin IV infusions, because that's something that you can interview these clients and say, hey, what's going on with your acne? What's going on with your skin? So look at the population that you have and see if this is something that you can cater to them. If you are new to the business and you have a different population and a different business model, so say you're an aesthetics practice and you're thinking of adding IV infusion services because your clients are requesting it, or your competition already has it, and you're thinking to yourself, I need to really add this. So say you're in medical aesthetics, you do hormone therapy, weight loss, you're a surgery practice, you do functional medicine, general skincare, you're an esthetician, you want to bring on something more medical, then how do you combine this service with other modalities? So, for example, Nicoletta was saying, you know, the microneedling and the IV together works wonderfully. So if you already have a medical aesthetics practice, then you really want to add this to your existing service menu. If you are doing medically supervised weight loss, you know, there are drips that you can do that help boost metabolism. You want to focus on that. If you're a surgical practice, if you're in plastics, you want your patient's wounds to heal. You know, if somebody's getting an upper and lower bleph, you want them to heal quickly. If you're doing CO2 laser with that bleph, you want that skin to heal over nicely, and you want them to have as little downtime as possible. This is something you want to add to that menu of services so your patients can have the best outcomes. And functional medicine, it just makes sense. You know, you're already talking about nutrition every day, so why not, you know, add this as well? And aesthetics in general, you know, building collagen, not to say that you're going to make your patients less dependent on fillers, because that's not necessarily the case. But if you have a full range of services and you get their skin in really good shape, it's going to optimize the fillers they have. It's always going to look better because they're going to have a better foundation to work from. So if you're already doing, RF microneedling and, you want your patients to do Sculptra, it's going to look that much better because you have them doing IV as well. And if you have those technologies, RF microneedling, if you have lasers in your office, if you're say you're a full-blown laser practice and you say, you know what, we want to do IVs and laser, it works so well together depending on the types of lasers you have, whether they are ablative, whether you have diode laser, you're doing laser hair removal, whatever types of services you're offering, you can see how well these services are combining. And we can go on to the next slide. So what this is going to do for you, it's going to elevate your practice. So you can utilize customized IV therapies, and basically you're elevating your care, and then you're going to set your practice aside from your competition. Nutritional optimization is ultimately going to have your patients have better outcomes. And again, standing out from your competition by having these comprehensive plans in place that have multiple modalities in your approach to your aesthetics, your skincare, your surgical practice, your laser practice, whatever it is. People are going to want to come to you and not to the guy across the street or the gal across the street, because they're going to know that you have this amazing approach. And that's something that's really, really important, because again, this landscape is really competitive right now. And you want to do something that makes you better and makes your clients look better at the end of the day. Next.
So this is just a QR code. If you guys are interested in learning more about the skin IVs that I spoke about earlier, or if you have any other questions at all that, if you want education on bringing IV infusion therapy into your, medical practice or aesthetic practice, we are here to educate everyone on that as well. If you're interested in the different infusions that we have, you're more than welcome to look into it and ask any questions you may have. That's at the end of our presentation. We'll put our cameras on so we can show you how we look like.
We are real people here.
Yeah, and then we can actually, start answering some questions if you guys have any.
Hi.
Hi.
Autumn, I don't know if you
see the questions.
I think it's an email. I don't know if the chat is open. I think we can hand that over to Autumn and see how she wants to do that.
Okay.
I think they might go in by email. So I don't know if the chat is open.
I'm looking at the different icons.
Yeah. Autumn, are you still with us?
I don't think so.
Did we lose her?
It says chat on the bottom, so let's see. Oh. Okay, so
I think Autumn did say that we would accept email questions.
As well, that can go through the portal.
And then go through the portal as well. So any questions that anybody has, please feel free to send them in, and then we can answer them. Hopefully we'll be able to get to them before close of business today.
Yep.
And then if there's anything else that comes up, please let us know. But you can always contact us. I'm at galvaniclife.com, and Nicoletta's at Replenish. Please feel free to reach out to us at any time. We're always here to help and help our colleagues as much as possible.
Because it's so competitive, and there's so many so many questions. Even businesses that are already open and they don't know what to do next in order to differentiate themselves. Jessica and I have a lot of different modalities and avenues that we can help you get more on track of the types of clientele you would like more coming in.
Yeah, absolutely. And if anybody needs help doing that, you can always reach out to us.
Yeah. guess that's it.
I think so. So
All
I think
right.
we still have to wait for Autumn to start and stop everything.
Us.
I guess so. We have 2 minutes left. So I guess anybody else gather up your questions because we're at 12:58 p.m. Eastern Standard Time. So if anything else comes up,
Yeah,
please let us know.
yeah. I'm just seeing if we can send questions. I don't see anything here.
I don't think the chat is open.
Yeah, unless Autumn is seeing it on her side.
I'm not sure. Autumn, we lost you.
I know.
Okay, well, so I think we are done. We can drop off.
Yep.
But again, please feel free to email, and thank you to AVA, American IV Association, for sponsoring this webinar. I know there's another one coming up in a couple of weeks, so please register for that one. There's going to be a big panel discussion, I think on March 15th. So everybody, please feel free to register for that, and hopefully we'll see you all soon.
Yeah, well, hopefully we'll see you all soon, get more down to the nitty gritty of things. More on the
Yeah,
science.
yeah, that'll be the plan for the next time. So
Absolutely. Okay.
All right, everybody. It was great. Have a great time, everybody. Have a great rest of your day.
Okay.